The coronavirus has taken the world by storm. The virus originated in Wuhan, China, and started spreading around November 2019. The virus has spread all over the world and has changed the lives of many. The virus is spread by respiratory droplets. These respiratory droplets can be spread by coughing and sneezing. People who are asymptomatic or have not started to show symptoms yet can still spread this disease. This is why it is important to wear a mask and socially distance, as it can spread fast and negatively affect people in high-risk groups. These groups include individuals as the elderly or people with severe underlying medical conditions. There are 59.1 million total cases and 1.4 million deaths worldwide, and 12.5 million total cases and 258,000 total deaths in the U.S. alone. The number of deaths in the U.S. is predicted to be around 400,000 by February 2021. These scary statistics have people worried and wonder how they can help themselves by avoiding contracting this disease. Research has shown that vitamin D could be the answer. Increasing vitamin D intake can prevent contracting this disease or the severity of its symptoms. Although vitamin D is known to mainly control the regulation of blood calcium levels, it also has a positive impact on the immune system when protecting against infections. According to scientific reports, a study was done comparing vitamin D levels in asymptomatic COVID patients, otherwise known as Group A, and severely ill patients, otherwise known as Group B. They found that, quote, vitamin D deficiency was 32.96% and 96.82% respectively in Group A and Group B, end quote. This suggests that there is a high correlation between vitamin D deficiency and the severity of the coronavirus. How do we address this problem? First, we need to identify people with vitamin D deficiency, especially if they are high-risk individuals such as the elderly, patients with comorbidities, and nursing home residents. After identifying who is high risk, we can suggest ways to increase their vitamin D levels. There are many ways to increase someone's vitamin D levels. Vitamin D can be synthesized through the skin, which means that by increasing sun exposure to about 15 to 30 minutes a day can make a good amount of vitamin D. However, people with darker skins might require up to 10 times more sun exposure to make the same amount of vitamin D compared to a person with lighter skin. A person's environment, such as time of day, season, and geographical location, can affect vitamin D synthesis. Changing one's diet to include foods like oily fish, egg yolks, and fortified foods will also prevent vitamin D deficiency. If one is not able to get enough sunlight or cannot afford adding these foods to their diet, vitamin D supplements are also available and are meant to raise your vitamin D levels. Remember, it is still important to practice wearing a mask, avoiding large gatherings, and maintaining 6 feet social distancing rules to save lives and stop the spread of the coronavirus. If you're experiencing symptoms of the coronavirus like a cough, fever, headache, tiredness, chills, sweats, aches, and difficulty breathing, go get tested and see a doctor.